Hi, everybody. I thought I would just finish up the urinary tract infections in the interest of time. This way, I can start wounds on Wednesday without having a great deal of time to invest in this. Because I'd like to get this Wednesday, Friday, and get working on the review that I'm going to give you as well. So, without further ado, this is where we left off. For those that were here, we will remember. For those that weren't, just pick up on this uh, when we get there. And this is the one we were working with here. Let me just go back. This is where we left it at molluscum contagiosum. I had just finished HPV. This is another interesting viral infection. This is a pox virus. Interesting. So it's large, and it is it's not unusual. It's just by intimate contact, but it's not fluids. It's skin to skin, if you want to think of it this way. Okay, they look a little bit like warts. It gets its name molluscum because a mollusk would be like a clam or an oyster, and what they saw was like a little white center and a red surrounding. So it was like a pearl or an oyster. Contagiosum just because it's contagious, and it can be on the mucous membranes, yeah, but it's mostly skin. Every time I've seen it has been on the upper thighs areas, and they're very distinctive, and it's there's very little. It's cosmetic, and certainly you would want to get it taken care of because you could pass it on to somebody with some kind of intimate or even just regular contact. Uh, might conceivably pass it on depending on where the contact was. And so all that is done is you numb the area and you use, when I've seen it done, dermatologists do it. It's called fulguration. You just numb it and you put the tip of an electric needle in there and boom, boom, boom. And then it's gone. And fomites can get it, clothing or that's what I mean. So you or auto inoculation, so you could inadvertently get it on something on your hand, a finger, an object, and transfer it someplace else. Let's say shaving your legs might be one way that we could see this occur. It's really not complicated. It's more cosmetic. It doesn't have uh, any consequences that I'm aware of. Beta hemolytic streptococci, Lancefield group B. Remember, group A is the strep throat strep. The problem is during pregnancy, and there can be some real significant problems associated. This a lot of different kinds of puerperal sepsis. You remember Semmelweis? This was kind of like the puerperal sepsis aspect that he observed when he did that paper and report that kind of where we began to identify the spread of disease, and it actually got him in some trouble with other doctors because he saw the doctors were to blame and the medical students. You might remember that early on we talked about things like that. So it's epidemiologically and spread of disease important. This is also a source for certain kinds of streptococcal infections in the realm of puerperal sepsis or with faultily done deliveries slash abortions, so intentional terminations of pregnancy, as you can see. So it's a pretty significant, and that was really what was left in this chapter. This is just talking about different diseases here, and those are the images. So what I wanted to share with you now that we've can finish with that is a little bit that came. It's basically the same material as they're the same PowerPoint. Uh, People more or less, and we saw some of these slides before certainly. And so I'm just buzzing through those and just trying to give you some pictures of the disease aspect of things that I talked about before. And frankly, they have taken away a lot of them. The one with the herpetic disease, the herpetic encephalitis at the newborn, it was just awful to see this baby who was clearly never going to survive, immediately within a couple of days, probably in the nursery and wasn't going to survive. I think it was very frightening to a lot of people. And you saw these were some of the cells, and you saw that same image for vulvovaginal candidiasis. This is the toxic shock nugget, and you saw the same basic graphs that were there as I buzzed through them. There isn't a lot left to do. I just wanted to get it done. And so this is the focus point. So interestingly, they start in a little different order with chlamydial. They're talking about chlamydial infections and their importance that are there. And that's an interesting thing. Uh, a lot of asymptomatic nature they talked about, just underscore that. Symptoms appear weeks to 14 days. And it's that lag between the time and the exposure and whenever the contact was and its demonstration of signs or symptoms, that's people are still contagious during that area. That is a problem. All of this is stuff that you see again and again that are there. There's the elementary and particulate bodies that you can see there. So, as we go back, the elementary body is the infectious form. What's inside the cell as it replicates is the reticulate body. And you can see, there's different types of antigenic types based on variations, and you can see what they are there. So they've been well studied and that are there, leading to PID, uh, persistent with regard to host defenses. So it's nasty. And they don't really get into the treatment, but as we commented on before, you're looking at vibromycin, you're looking at the Z-Pack seem to be working. This is one of those troubling images from gonorrhea. You see that in a lot of textbooks. It is that white to golden yellow, almost creamy pustular discharge, and that's just awful, and it's very, very painful. Particularly so for men with urination. You'll hear it described about, extraordinary pain that clogs up. It's almost like initiating the flow. It's almost like a cork that pops. It's very, very painful. Okay, and there are a lot of disseminated infections that can lead to all sorts of problems. And you can see all the little fimbriae that are here, and that's really where the attachment comes from. And they go into the cytokines and pro-inflammatory agents, etc., that are there. I would agree that this probably had HIV/AIDS really increased, and we identified the word condom became part of the lexicon. People they would hardly say it. We knew about it, but they would hardly say it. Okay, and again, it was much more about things that were used to prevent pregnancy as about worrying about because they figured all these diseases were treatable. Little did they know. Okay, and again, it's sexually transmitted. So that's one of the images to show you. Mycoplasma can also cause these. Again, it's probably in the same idea as chlamydia. They're not necessarily terribly symptomatic. Uh, mycoplasma is like walking pneumonia. It takes a little bit longer. So its detection is difficult. It's not notifiable. I think it's just hard to identify. But the treatment is sort of from a physician perspective. You see that just because you're concerned about things like the potential for being gonorrhea or chlamydia, you would probably treat them similarly. So you would be certainly, quick to use antibiotics if you were having difficulty getting a culture back on that. So antibacterial medications, as you can see there, these, pardon me. So this is the syphilitic lesion. That's a chancre. Surprisingly enough, that isn't sore or painful. Here's some of the secondary signs, all the rash and the breakdown and the blistering and the tongue and all of these things. And as you can see, all the different things it can have, antibodies are still present. And that's how you would measure it, even during early in the latency. And about 25% of people recover, 25% of people don't change, and the remainder progress to that late stage. And all this is untreated. So you can treat in the early portion of this. So you could certainly treat this a year or two into after the signs of secondary syphilis. This is a classic example of a gumma. It's like a soft spot that's deteriorating. It's a granuloma in nature. It can be anywhere. And it's not just losing skin, but it's going to lose bone, and the nose is going to lose cartilage. Okay. Very, vascular abnormalities. Neurosyphilis is not rare. Okay. The personality changes, emotional instability, all of this is where they began to see the need for sanitariums because so many people were behaving crazily, and it can occur earlier as well as later. And the treatments were very unreliable and probably as fatal as the disease itself, like with inhaling mercury vapors or topical mercuric things, because they're nasty in and of themselves. So, long story short, terrible disease. All of those things. And then it's passed on when you get to the congenital syphilis. Those are the notched teeth. Okay, Hutchinson's teeth. So typically, you begin to see bones, cartilage, deformed eyes, inflammation, deafness. Terrible. If you want to go look up Hutchinson's triad, you can see all the different things that are there. There's the spirochete, fortunately easily treatable, uh, as you can see. Once after 5 to 20 years or longer, some develop. Not all. The tertiary signs. You see, it causes something called tabes, TABES, dorsalis, and it affects what are called the dorsal columns. Those you might remember if you studied them or if you talked about them in A&P. Those are the up the spinal column in the back, directly posterior. Those are all those proprioceptors. So you can kind of tell where your body is, and they have, people develop a very distinctive way of walking. That's a giveaway. It's almost like a we've seen that with diabetics. To some people they're unstable, like somebody's drunk. That kind of a walk that's there. No vaccine, as you can see. The chancroid, you can see these. That's a lymph node that starts to open up. It looks almost like a tumor. You just don't see it around here. I thought I'd bring that in. The viral ones, these are the classic blisters. They're much more superficial on the surface as opposed to the chancre and syphilis, which is deeper and redness, irritation, little bumps. So maybe a discharge, maybe not. Early severe, then they kind of improve. Those kinds of things. Hold on. Yeah. Yeah. Hello. Hey, you in transit? Not yet. Okay.